give rest.
Okay, now we're going to make it Mitten a chance to talk. Short?
So we have CBC News here, Global News,
I've got my
and
daughter
CTV
here
News.
with me, and I want to make sure I have a
Okay, I wanna-
sight line to her.
I'll walk before you.
Okay, Quinn, yeah, can you make sure you sit on that bench, please, so I can see you? Thank you. All right. Thank you, everyone. Just can't lose a kid.
Okay.
Thank you.
Okay. Thank you. So I want to start by saying thank you. Yep. All right. Hello, bonjour, Gui. I want to start by saying thank you to Sherry and everyone who organized coming together today. You know, we face many crises in our province, whether it is housing, whether it's affordability. You know, people are trying to buy school supplies right now. The cost of everything is going up. And food insecurity is a major issue. There's the climate. But today we're gathered to talk about healthcare. Healthcare is a crisis that has been coming on for a long time. And unfortunately, successive governments have failed to do what needed to be done. But this is a long time coming. We've known for so long that we were going to be facing a shortage of nurses, that we were going to be facing a shortage of doctors. I'm wondering if I need to pause, or are you picking up on what I rest?
We're picking up.
Okay. All right.
So we're pausing the interview. There's a distraction in the background here, so.
And that is very important in democracy, and that's why we're here today. So, but when we look at Premier Higgs, he has been finance minister, now he's been premier, and he has not done what needed to be done, and frankly has made things worse. We have not seen the investments in our public healthcare system that we need. And now there's even more talk of privatization, and this is not the first talk of privatization. We've seen Ambulance New Brunswick, we've seen Extramural, the management of that be privatized, but now they're floating that around. What we don't need is privatization. What we do need is actual investments in our healthcare system. And it's not like there's a lack of solutions, there's a lack of political will. We know that doctors and nurses and other healthcare professionals, whether it's LPNs, radiologists, that they have been throwing out solutions, that they have been warning us for so long about what needs to be done. We need to better fund post-secondary education. If someone wants to become a healthcare professional, we should be paying for that. Post-secondary education is so expensive, and so we need to be funding tuition for healthcare workers, and frankly, we need to be moving across the board to make it more accessible. For people who want to upgrade their skills, we need to be funding that. Paying the tuition and making it more accessible, whether it's an LPN wanting to become an RN or someone else, we need to be making it accessible and funding that, making sure that they can practice at their full scope of practice. There are so many suggestions that doctors like Dr. Segal, for example, have been presenting, and so we need to hear, where is the plan? What is the plan? Because that 2-year plan that they presented last year was not good enough. It just shows the plan for privatization. It didn't show the plan for training, recruiting, and retaining healthcare professionals, and it was unacceptable. I also want to add that, you know, the privatization is a concern, and this move away from democratic decision making. We've seen the Premier unilaterally get rid of the partially elected boards of the healthcare networks, and that's absolutely unacceptable. C'est absolument pas acceptable de ne pas avoir la voix locale, et en particulier, il faut avoir les représentants élus qui peuvent prendre les décisions. Et c'est important pour la communauté francophone de gérer son système de soins de santé, et aussi c'est important pour le Horizon, pour les anglophones. Mais c'est pas acceptable ce qui est arrivé, et ça va contre la démocratie. So, I have seen firsthand what it means when there are not enough nurses, there are not enough doctors, when there are people who are not able to have a hospital bed. My father ended up, we couldn't get him into a hospital bed and he ended up being in a hallway when he was sick and he was dying. It was absolutely unacceptable. And I've seen firsthand what this means, and obviously he was not the only one. We're seeing this across the province, and it's only getting worse. So I'm calling on the Premier and the Health Minister. Where is your plan? Where are the public investments? Make it clear what you're talking about and back away from privatization, and listen to the healthcare workers, listen to New Brunswickers, listen to the patients, because we deserve better. New Brunswickers deserve better. Les gens de Nouveau-Brunswick, les Néo-Brunswickois, Néo-Brunswickoises, les docteurs, les infirmières, vaut mieux. On devrait avoir un système de soins de santé qui fournit des services. Si on est dans une région rurale ou urbaine, c'est pas acceptable d'avoir des fermetures, de ne pas avoir des investissements dans notre système de soins de santé public. Alors merci beaucoup tout le monde, merci à les gens qui ont organisé cet événement aujourd'hui. Thank you everyone. Merci Wulalia.